In an effort to grow a healthy and empowered society, the county government of Vihiga has committed to providing equitable, affordable, and quality health services to its people.
One of the key pillar programs in my CIDP is primary health. I personally believe that if we address the primary health, or what is called public health, I am confident that the issue of diseases will be addressed. More than 50% of the challenges we face in the county in terms of diseases will be addressed, because most of the diseases can be prevented.
So for us in Health Devolution, as it is envisaged currently, has been one of the best systems that can at least be able to improve health at the grassroots level. And as you all understand, the 7 pillars of healthcare delivery, there's the aspect of workforce, and that is to do with human resource. There's the healthcare financing, there's the issue of infrastructure, there's the issues of commodities, there's the issue of technologies, the issue of leadership and governance, and lastly, the issue of partnerships. And since devolution was incepted, that was in 2013, and in 2014, health was fully devolved to the counties, we have seen marked improvement in all these key areas of provision of care to patients, which all dovetail to one thing, that is the aspect of service delivery for the patients.
Primary health is what I'm giving a lot of emphasis. And to do this, I've created a fully fledged department of public health. And it's going to, more of its work will be civic education, because most of our people are suffering because of lack of knowledge. And one area that I believe is very important is level 1 education. So my level 1 is where we are going to train community health workers, people at the village level, who we can train in basic health practices. And once we train them, they will be now my foot soldiers. They will be the level 1 healthcare group that will be on the ground.
Currently, we are able to do the issue of human resource advisory at the local level. If you have any cases of those staffs who are involved in issues, we're able to handle it as a county. If you look at the issue of numbers, the numbers are still a challenge, but at the end of the day, devolution has attempted to be able to bridge the gap. For example, the number of clinical officers, the number of nurses has improved slightly because of devolution and local recruitment.
We have recruited 961 community health workers. These are people who are knowledgeable about health. We are also working with the various donors, and in this regard, we are already working with UNICEF, and we are going to start a program which will now target the women who are pregnant and the children, maternal care. Women who are pregnant, we shall be able to identify them using the community health volunteers. We shall register them and ensure that they go for clinics as required.
One other component of the pillars of healthcare that has really been supported by the counties, and I'm speaking for Vihiga County, is technologies. And technologies, for instance, surveillance systems. We have CCTV, and that CCTV, we are primarily using it for surveillance, and it assists us in not only monitoring the hospital security, but it also helps us the flow of clients. For instance, some clients will come in with complaints about the time it has taken for them to be attended to. We're able to use that surveillance system to be able to justify and even to improve our services administratively as an institution.
We are also working with the NHIF and the key stakeholders on the ground using the community health volunteers to identify vulnerable households who will benefit from this program, where we have health insurance, which ensures that once you have the health insurance, and then when your family gets sick, you just access to healthcare in any of the hospitals, whether private or public.
On infrastructure, we're having a lot of development because development money directly comes to the county, and health being a key component of the county governments, they have actually put a lot of premium on improving health infrastructure. For example, if you come at the county referral hospital, there are several areas that we have been able to improve, and one of them is the hospital plaza, which was supposed to be built at the same time this institution was being built way back in the 90s, but that never picked up. But currently, because of devolution, we are having that building coming up, and other service areas that have been improved, including X-ray, maternity, theatre. We've been able to even have our NHIF unit, and you have built it and it's working. So you're able to customize the infrastructure that you want. And infrastructure also comes with equipment. You're able to buy the equipment that best suits you. Previously, you'll be sent an equipment from the national government with good intentions to improve service delivery, but probably not even have a place for you to keep that equipment, or will not have the expertise to handle that equipment.
Most of our sub-county hospitals, we want to upgrade them to a level where they become referral, so that most of the diseases can be treated there without them having to come to the Mbale County Referral Hospital. So we are also renovating these hospitals. We are putting the required equipment, and we have recruited the doctors who will be responsible for these sub-county hospitals. We are equipping them with the requisite drugs, requisite laboratories, theaters, so that all this work can be done at the grassroots.
The patients are appreciating more the services that are being provided through devolution.
Tunashukuru kaunti kutuletea matibabu karibu hapa Vihiga, kwa sababu wengine hatungeweza kufika Kenyatta. Kitu cha kwanza, mimi mwenyewe mgongo yangu ni mbaya, siwezi kaa kufika mbali. Sasa ninashukuru sana.
Job creation is very important to my government, and we have identified areas where we can create jobs quickly for our youth. And in this regard, education is very important. And we have identified that we are going to focus on technical and vocational training. It's one of my second pillar program, where we have embarked on putting up a TVET master plan, a plan that will help us renovate all our youth polytechnics. We have about 31 youth polytechnics in the county. We want to renovate them and equip them with the modern machinery, and then hire very qualified instructors so that our youth can go to these polytechnics where they will be trained in skills. In our youth polytechnics, I don't want theory, I want practical. We are also entering into an agreement with an institute called Toolkit Institute. It's an institute that is in Nairobi, and their work is only to find internships for our students who will be in the polytechnic. So once they are in polytechnic, during holidays, we want them to go for internship. If they are learning motor vehicle mechanics, we want them to go to General Motors. We want them to go to Toyota Kenya. We want them to go to Isuzu factory where they can see things done. We believe from there, when they come out, we will be able to set up an empowerment fund where then they'll be able to form their groups. From the youth polytechnics, they form groups, construction companies and so on, and they come out, we give them money as startups, and they start up their own companies. And once they start their own companies, we shall give them 30% affirmative action as contracts within the county.
Besides technical, vocational, and educational and training, the county has set its focus in promoting sports activities for the youth.
The Vihiga county government facilitates for matches. They pay salaries for players as well as buying equipment for the team. They also cater for any other need that the team might have at any time during the off-season and also during the in-season trainings and during matches also.
Through the county government of Vihiga, we got a sponsorship from them, and that really motivated us to work extra harder and become the champions.
Tukianza ilikuwa ngumu kidogo. Moja county pia ndo ilikuwa imeanza mambo kusponsor sports, haswa football. Lakini tukiendelea hivyo, tukipanda, tukigrow, imekuwa ikichipin vipawa sana. Tukienda game hiyo ndio inasimamia kila kitu. So imecheza part kubwa sana.
We have planned to upgrade our roads to all weather in the whole county. Unfortunately, we have so much rain now. We had already started the program, and the program is being funded by Kenya Roads Board. We want to make all the roads all weather. We have identified roads that we would want to become bitumen standard. As I'm talking now, a road from Ekwanda to Luanda to Esirulo to Esibuye is being tarmacked. A very important project that is coming to the county. This project is called Kenya Urban Support Program. This is a program that is being funded by World Bank, and it is funding all the 47 counties. And the aim of this project is to establish urban municipalities and cities under the City, Municipality and Towns Act of 2012. Also under the Belgium funding, we have secured through the national government 1.7 billion shillings, which are aimed to improve the water supply in Vihiga County. And this 1.7 billion water program is going to target Kaimosi, Mbale, and Majengo. And when it's complete, it's going to serve more than 270,000 people. To spur development, we have entered into agreement with the Kenya Electricity Authority. We are going to light all our markets in the Vihiga County. We are starting with the 37 markets. We are going to put high mast floodlights so that people can do business 24-hour and we minimize theft. Vihiga County, we want to use ICT as our platform of development. So we are going to put all our sub-counties, we want to put them on fiber optics. We want our development to run on ICT.
In line with the county's government's vision to transform Vihiga into a prosperous county, a leading county in sustainable utilization of available resources for rural development, great plans are underway to connect Vihiga County to other regions and indeed to the world through the internet.
So if you are going to come here, you will be sure that you have to be ICT compliant.